Hello, my dear girls. We will need to, for today's lessons, the band and the clean suction cup. If you don't have the cup, it's okay. We will use the hands. If you don't have the band, you can use a scarf, a leggings, something probably that stretches is the best. And I want to start with activating some of the muscles that around our clavicle, underneath our subclavius. We will go in deep and move our shoulder forward. When you move forward, you can feel that you can go deeper and back. So forward 3 times and back, and you just stand at the beginning of your clavicle. 3 times forward and 3 times back, and you just digging your fingers under your clavicle. This the same. You go inside just so you can go deeper, and you find this poor muscle and back to stretch that muscle. 3 times forward to dig deeper. You don't go, you just stay here. The muscle is just small right here. And again 3 times this way and 3 times towards the back. Very good. Now we're just going to slap on top of our clavicle. Just slapping, 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 slapping on top. Very good. Now take your band and we will do the resistance exercise. Again, remember you trying to imagine that there is a helium balloon that lifts you up and moves your segments of the spine very little, not like too much, just a little bit, and you press your resistance bands with the back of your neck, making this longer, making this longer, this longer, not like this, nothing, just straight, but you making it longer on the back, and you hug it like this and make it longer, and little tilts of, feel like you grow a little taller, and continue this resistance. Then relax your hands. You can stretch your hands. Doesn't matter, just have the resistance. So you can take your band a little closer. You decide how far do you want to go. If you go too close, you will just need to include more resistance, and you feel the whole spinous muscles activating, and you just elongating the back of your neck. That's it for the band. Now we go back to our trapezius release. Up towards the back, shoulder up towards the back, up towards the back, up towards the back, and tilt your head and lower it on your trapezius. Breathe, enjoy this little burning feeling around your upper trapezius. Drop another shoulders, tongue on the upper palate. Breathe. You can bring your palm a little higher if you are ready to bring your shoulder higher. Breathe. Sit on your sitting bones, please. No leg crossed. You're staying. Roll your head and let's stretch the trapezius with a very deep fascial stretch. Slow, right on this, up to your skull. Very good. Slow, going slow, removing all adhesions. Now bring them this side of your hand behind your back like this. Lower your shoulder, take your head and stretch it from this way. Place your hand on top of your head, and just under the pressure of your hand, let this stretch for another 5-10 seconds. Breathe. Very good. Take your hand, bring your head back with the help of your hand, and let's go second side. Shoulder, sorry, my suction can't fall. Shoulder up towards the back, shoulder up towards the back, shoulder up towards the back, tilt, drop, not overextended, bringing shoulder higher. Shoulder is trying to meet the back of your neck, not the back of the neck is trying to get dropped into the shoulder. Breathe. Breathe, breathe, breathe. Inhale, exhale. Inhale, exhale. Slowly, slowly, you're gonna roll back to the neutral and stretch with the hands. Just stretch towards your occipital bone, so towards the back of your neck. Stretch deeper. No, don't be afraid of anything there. Take your hand like this, knuckles, then drop the shoulder, bring your head a little bit away from the shoulder, and under the pressure of your hand, stretch all of the fibers. Breathe. And breathe. Take your hand, help your head to go back to neutral, and below your ear and right on the back, we will be just doing these motions as we activating the lymph and go towards the back with this motion inside deep like this. A little bit vibration, and then you go towards the back of your skull and a little higher. Now you go right behind your ears, little motions, and go right behind. And on top, get in, dig deeper, and go right behind. And on this area, you will start moving, scratching your skull this way. Scratching your skull this way, right on top, right on the middle of your head. Just scratch this tissue. Remove the tension of the tissue. Scratch it, but scratch it not like with nails. You're scratching it as very deep motions, okay? And slowly slide down towards the back of your neck. And again, up and towards the back. Up, a little more active towards the back, up and towards the back. Very good. Now take your suction cup, or you will be doing it with hands. We will be relaxing our temple and temporalis using the suction cup. So I want you to start finding this bone, this area, and right on top of your eyebrow. If your skin doing something like this, you can use the hand to pretend this way. I know exactly. Then you tilt your head. You can put your elbow on the table, and we start doing 10 circles. Tilt your head to increase the pressure. 10 circles. The circles are with intention go this way, so not like this, more this way. So maybe like half of the circles, like a half moon, and you go right next to it. Tilt your head and think about removing this tension from the bone, but you don't push the bone. You just work with the tissues that on top of the bone. Now this way. On a hairline, you will need to go a little deeper, so you will need to really tilt your head. But again, if you feel a lot of discomfort, you just do it here, so it's less discomfort for you. We don't need to be discomfort. You decide the intensity of the exercises for yourself. And we stop where up the ear stops, and then we go upper level. Okay. We are removing the tension in temporalis by going deeper, by applying a lot of pressure. Our fingers, perhaps, if you try this with your fingers, and if your fingers are not ready, not strengthened, they cannot go as deep. and we save in our fingers using the device. And of course you can do it with the fingers. I'm just trying to show you if your fingers are tired and they might be tired after what we're going to do today. So let's this a little support for your fingers. And then slowly just relax. We will be relaxing our rufous receptors by placing 2 fingers and making the 8. So you are not going with your fingers sliding around. No, you glue your fingers to one spot and you make those 8 symbol or infinity symbol, 8 that lane. Just like this. Just very nicely. And slide it all down. The eyebrow like that went up. Now again, we start from here, all passes. 10 circles away from your middle of the face. Breathe. If I feel like a lot of tension, I just bring my head straighter. Second pass. Very important muscle, temporalis, very strong muscle, connected to the masseter. The temporalis also, it's a skeleton muscle, so skeleton muscle has their own different layers of fascia. Unlike our facial muscles, they have only superficial fascia, not a lot of deep fascia here. But skeleton muscles, oh, the eyebrow liked it. 2 fingers, remove the tension, so number 8, laying, number infinity, not the 8. This is for the rufous receptors, including when you're doing rufous receptors, they put in your parasympathetic system on, which is very important for any regeneration issues. Like if you want to regenerate, we need to be in parasympathetic system mode. Now we will take our protect our eye like this, and with this finger, so you put your finger in between your eye and like this, okay, protect your eye. And with this finger we will be sliding the ridge on top of the nose diagonal like this, sliding all of this that gets to the bone, sliding up. So again, we are not pressing, like I'm not pressing into the bone, I'm trying to clean up this bone, okay? And this is pre-tensioning and letting me go right where I need to be. Couple times, I mean more than couple times, but just know what you're doing. Don't slide on the skin, grab this muscle and the ridge. Use your finger, big finger as a support, and slide it all this way. See how eye opening after you work on this muscle? This is beautiful. And working on this muscle also helps the whole liquid fall into here where it needs to go. But we also need to open this area in this little muscle, so all of this can go into your tear through. Protect, and pre-open, and diagonal tissue, diagonal. You're trying to grab this brachiosaurus and beginning of your eye muscle, and just it's a lot of sutures of the skull here, so a lot of tension can be coming from the bones. So that's why we very delicate and we don't press into, we clean the bone. Like imagine here would be a gum stuck. I would not be like going into that. I will pick up the gum like this and try to remove it. Don't know why the gum would be stuck in my clavicle, but I think that's a good comparison. Now we go into our little one, and on the little one we will again take this like a half, and imagine like this one is opening. You always imagine this is a little pretension and you opening your skull, pretense, and 10 circles on that muscles right here. Right, this muscle is connected right here. You will you might not feel it, but if you feel it, you will feel it's like a string. And if you don't feel it, it just tells me that the muscle is so almost embedded in your bone, then it is very tensed. But if you feel it, it's like a string, like a headphone wire, and very nice little criminal, because nasolabial folds, eye bags, tension here, hooded eyes, and liquid here. Okay, let's talk in doing. Okay, 10 deep circles. Don't be afraid. Deep circles. You got this point, and you massage 10 deep circles. You slide down, you don't lose the depth, and you stop in right here, and you stretch this like this. You go in and you stretch, go in and you stretch. Again, pretension and 10 deep circles. Please don't do anything that like a big circles. As small as circles, as better, because that tells me you probably hitting the spot. Cleaning the sinus at the same time. And stretch. And stretch. Now bring your hand and start doing the circles under your eyebrow. Right on an orbital ridge. We will work a little with the orbital ridge. So we need 5 circles on one spot, 5 circles on another spot, and I want you to understand that orbital ridge finishes right here. It's like a this, and we will be doing massage right now on the top, and then we will be going on a ridge. So just get familiar with this area under the eyebrow, removing the tension. All the way. Now I want you to eyebrow. I want you to take your 2 fingers and stay on the ridge, like where we were, and now slide down. You are not in a soft tissue, you are not feeling the eyeball. You're right on the ridge here, right on top of that ridge. Here is the ligament of the eye. With the ligaments, we need to understand there is no big stretch will happen, but the relaxation is must. So you tilt your head, you are like, okay, am I there? Am I sure that my hands not feeling eyeball? Yes. Then bring your fingers 0.5 centimeter apart from each other, like this. Then get up, repurchase, so go on another, a little bit away, get down. Am my hands are good? Am I feeling the ridge and I'm not touching the eyeball? Yes. Then move them a little bit apart from each other. You will feel that very dense tissue. It's not going to get the stretch. Again, tilt. Am I there? Am I there? Am I sure that I'm not sliding on the skin? Yes. Orbital ridge. Perfect. And in the corner, am I there? I'm not feeling the eyeball. I'm right on the ridge. Yes. Stretch. Stretch is a big word, but relax. You see how this works amazing with the eye. Go back to the second one. Right, start right with the ridge. First, let's remove the tension from the eyebrow muscle. I get excited with the advanced techniques. But we need to work on this corrugator tissue, and this is your orbicularis oculi, so your eye muscle. But your corrugator is very powerful and send the tension here. They're all connected. They're forehead current connected. You cannot just separate them. Go here. Am I there? Am I knowing what I'm doing? Am I in a reach? Yes. Stretch. Am I glued to the reach? I know where I am. Stretch. Am I there? Yes, very good. Stretch. Do I know? Yes, great. Stretch. And the corner. Am I there? Yes. Feel the reach and little stretch. Now place your fingers on top of the eyeballs, very light, your preferably ring fingers, very light, and start making 8 with your eyes without lifting your eyelid. Your hands are very lightly touching the eyeball, and then number infinity symbol one side and infinity symbol another side. Very, 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 very good. Relax. Now take your, this is working amazingly. Now we will remove the tension from the top, and from the top I want you to remove the tension by pinching this. But let's protect our orbicularis and start pinching this corrugator. So we work only on a half of the eyebrow. Pinch, 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 pinch. Now take your finger in this position, like this. Protect this side and slide down, drop your head. Slide down, drop your head. This finger doesn't move, the other side. And again, slide down, drop your head. Girls that have here a lot of bulky lymph gel, the ones that makes like here a big bulk. This is your exercise. Will take some time because that gel is already glued to the bone, but everything what we're doing will support. But this is your extra for 20 minutes to like this. Okay, let's go back to into the pinching the corrugator from the top. Pinching all everything what's on top of our eyebrow, and we don't want that. And then stretch. Tilt your head. Tilt your head. Very good. Very good. Now we need to relax our forehead since we in the area, but we start with the relaxation right here. You can just go not too far. Like this. Bringing all of this tissue up. It wants to go down. Slowly, slowly, slowly remove all tension. Vibrate. See, am I getting all sweet spots? Now place your hands like this, holding your forehead muscles, and I want you to imagine like your fingers glued, and you try to open them, but you're not gonna slide like this. You're going to kind of like, oh, and they got stuck, and then relax your shoulders, and then open, and again. They kind of get stuck, and then you stretch, relax your shoulders, and you open, go all the way. Couple more times. Feel this pretension and move them. Feel this pretension and move. Reminding about big, deep forehead wrinkles. If you have, you can take your 2 fingers, open up the deep forehead wrinkle, and work perpendicular the muscle fibers like this. As long as you need. Trust me, if you sit like this after all of this complex and you stay on this exercise and you remove the tension this way for a good 30 minutes, you will see how your forehead wrinkles improve. If you do this for 2 minutes, it depends on the depth of your wrinkle. If it's deep, probably it's not going to change a lot. But if you do it for a good amount of time, blood comes in, you remove the tension, you can actually go to periosteum of the bone, which is the bone. You know, you can, because the forehead muscle very close to the periosteum of the bone, and then you just stretch. So this is all will be taken care of. And the last exercise that I'm a little hesitant to give you, but we need to address it, and there is no better way of addressing it. You will touch your zygomatic arch, okay? So you touch your zygomatic arch. You take a fold. So girls, not little one, this skin, no. You take a good fold of everything which you can pick up from the bone. Don't be scared about anything, okay? Take a fold, take not like this, just like this. It's a little diagonal or even more horizontal if you want to. Not deforming the eye, so don't take something like this. No, just from the zygomatic arch. And I want you to start walking with your fingers, checking what got into the fold and grabbing even more tissue away from your bone. Okay. Do you feel some tension spots? If you do feel tension spots, you stay on them like this. You can vibrate the fold. And then you walk again. We need this tissue be the same inside. No tension spot, not inflammation, zero. Then you stay. You already grabbed your fold for a second, you walk there. And then you, with these two fingers, the ones that on top, make a little slide away from each other. And then you go away, stand with those fingers and slide a bit. And then you go under your cheek, take again, compress it, feel, oh, is it soft or is it like very painful? Tells you a lot. And then stretch, and then slowly put this back. And don't look at yourself in a mirror, because this deep work requires a little time to, you know, mechanically the receptors to come down the skin. But we will do something else afterwards to come down the skin. But just know that the result of this work usually comes a little later versus some more superficial work. So we make sure that you don't have your eye there. We walk around. You don't have to go all the way deep, because here's the bone. This is no more fat buckets and ligaments that we are trying to work with. Girls that have something here, you don't worry. You just don't touch under the eye area. You walking right on the bone. Oh my god, I passed the 20 minutes. Okay, remove the tension, this is the first time, and then stand with your upper fingers and a little stretch. A little stretch, a little ischemic compression. Walk, 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 walk. Don't be scared of anything. Be scared, never go there. Be scared, have the muscle super tight into your periosteum, that periosteum doesn't get blood flow. Be scared of that. And relax slightly. Good. Now we put two fingers, and again those infinity symbol right on a corner, just to calm down the skin. And another infinity symbol. And again, we don't deform the eye. Fingers are glued to your periosteum. Just calm down. Take your palm, put your apple cheek there, slide down in your temporalis, and slowly, with vibration, just tell those skin receptors it's all good. And slide down and relax your cheek muscle. I mean, bring it to the tonus. Probably the best way to say. I'm feeling my bone. Very good. And again, drop your head And slowly, vibrational, bring it all there. Drop your head. And a little scalp massage, but it's already 30 minutes. So scalp massage is your homework. Thank you, girls. See you soon.